Public Health. I'm switching gears a bit because I think as we have done these workshops, and we really want to make sure that you're not just focused on the modeling. This morning, you all introduced yourself. Many of you were practitioners from health. Some work in research institutes. Others are engineers. And so for some of you, you're going to know this information. And for all of you, you've been exposed in some way. And the purpose of me framing this for you now is to help you think about it in the context of the cases that you're going to beginning this evening. Some of the cases actually are critical emergencies that are resulting from releases. And in that context, then, as you are working on the case, we want you to not only deal with the modeling, but to really think about this from the perspective of a practitioner and have a holistic approach as to how this would really relate to implementing policy, prevention, etc. So bear with me as I sort of present a context for you to consider. And in many cases, as you're assigned the cases this evening, it will resonate. And I want you to do me a favor, is in your groups, just remember to consider this, right, Patrick? Because oftentimes you get so bogged down with just doing the calculations that in the end you've turned in something that may or may not be really adaptable in an actual context of how you might practice. So from a preparedness standpoint, disaster and risk reduction is a key role of public health. We know that prior to the last 20 years, when there was lots of advancements in the field of public health preparedness, that most of the deaths have occurred in poor countries with limited infrastructure. And in fact, a lot of this has occurred in Southeast Asia and Africa. And in the last 20 years, then, there's been more of an evolution to the approach. As opposed to just responding and addressing from a relief perspective, an idea of risk reduction and planning. And so that's how the discipline of public health preparedness has emerged. We talk a lot about risk in this course, and I want to sort of review and help you think about the context of risk then with regard to a preparedness approach. In that same vein then, the framework and the elements to consider relate to minimizing hazards, vulnerabilities, and therefore risks to avoid and or prevent ultimately, and to limit or mitigate and prepare for. Because ideally we want to be planning and preparing and not just responding to a humanitarian emergency. So risk reduction then is sort of this pre-disaster, pre-emergency, preemptive part of development. And in your exercises, as you're thinking about this, think about the fact that the case itself could lend itself to preparing and planning and implementing new policy. That a particular scenario might really point to the fact that there needs to be more infrastructure because a release of that magnitude could be devastating, for example. We're focusing a lot of risk assessment, but in fact, from a planning and preparedness standpoint then, that data and information could be used for risk reduction and mitigating hazards, thinking about vulnerabilities and reducing them, and in the context of policy and sustainable development. There's another element to this that I'll discuss this afternoon relating to equity and vulnerable populations, even because armed with this information, we also should be able to position ourselves to really address some of these special populations. So the approach then, integrating more of a preparedness or emergency response framework, would mean that at this risk assessment phase, you could then take this information to set priorities. There are policy implications that could come from this. And as you can see, just looking at this diagram, that ultimately it helps us improve from an educational standpoint because we know we need to train individuals, first responders, clinicians, on how to respond in this type of event. Other contingency planning, even understanding some of the financial barriers that might exist. So exactly what is preparedness? When people throw this term around, we're really talking about these pre-emergency actions, the planning that is involved prior to an emergency and a disaster, which is why you should feel a lot of pressure as you're doing these cases, because this is the type of information that helps inform. And it's not just a mathematical exercise. It's like a real life scenario, or has the potential to be. This is a long-term planning. It's part of a larger risk reduction campaign. It has a comprehensive application across sectors and in relation to sustainable development. And it should be culturally sensitive and specific. As I mentioned, there are very different demographic groups and situations that exist in any society. So as you're doing these exercises, you also need to consider that fact as well. The overall objective, of course, is to prevent morbidity and mortality and to really provide care in these emergency situations, to address the casualties, to manage the adverse impacts on the climate, the environment, health of people, restore normalcy, whether it's health or economic development, protect the public as well as the staff. So people tend to reference these E's of emergency preparedness. And again, I throw these out to you to help you think about the context of your work in relation to the fact that in this short course, you're going to focus a lot on calculating risks and doing a lot of modeling. But what implications does it have on things from the economic drive, epidemiology, the enforcement of laws and codes, planning for emergencies in general, even the stockpiling of medicines and equipment to address that particular type of scenario. Obviously, education and how we might inform and help train personnel to deal with these situations. How do we plan with exercises and drills? Are there early warning systems that could help us in terms of protecting public health? Evacuation type strategies that might be helpful, as well as how do you evaluate the overall scenario and the ability of our systems to respond. And finally, with the advent of technology and communication, what role could that play? So in health, we know that mHealth and using cell phone technology, again, has really increased the opportunity to provide more services in very rural areas, for example. So the probability of suffering damage to life, property, economic disruptions, and environment tends to be the context of risk and preparedness. And so although we won't remind you a lot about that during the course of the rest of this workshop, we absolutely want you to think about this more holistically as you're doing your cases. Typically, there are two types of activities that relate to preparedness and risk management. One is the planning actions, as I mentioned, and the second is establishing protective mechanisms against not just the loss of life, but even the economic losses, which could be insurmountable. As Dr. Frank mentioned, in more recent times as well, we've been positioning our systems to respond to all types of events, including bioterrorism. And bioterrorism at times is sort of dealt with. There was someone here from defense. You're from the defense, and you all deal with bioterrorism within that particular institute ministry sector. And so this is one of those areas that overlaps also then in public health. And unfortunately, increasingly, we're trying to understand the context of this in relation to lots of factors, because we have an increasingly global society. There are a lot of political, social, ideological, philosophical reasons why these types of events emerge. And it forces us then to work beyond the boundaries of just dealing with the biology, but understanding, how is this driven? How is it funded? And how can we respond? So we've increasingly begun to think about this in the context of other sectors, whether it's agriculture, whether it's health, whether it's understanding it in the context of defense, etc. So in fact, some of the cases that you're thinking about, can that particular agent be weaponized? What would the significance of that be in that context? We want you to think about this outside the box then, and not really just limit yourself to the scenario that's on the page, but what are the implications beyond that scenario? And And that's the kind of thing I'm sure our colleague here thinks about all the time. The other thing I want to point you to is a number of resources. So the U.S. Center for Disease Controls has a lot of website information related to different types of emergencies and outbreaks. I've taken a snapshot here of the water-related emergencies page. Again, great information for really understanding how things are put into place with regard to policy in an actual event. The UN Office for the Coordination of Humanitarian Affairs, does this around the world. Again, this tends to be set up more from a response approach, responding to a humanitarian crisis. And we'd like to consider what you're doing here more on the preparedness and planning side so that we're preventing the impacts or minimizing the impacts and lives lost. So the examples of sort of how one might have to respond are really available through the UN as well. ReliefWeb.org has up-to-the-minute snapshots of crises around the world. This is an old snapshot of cholera epidemic in Haiti. It's Relief, ReliefWeb.org. If you go to that now, you'll see everything from crises related to food security, hazardous releases, lots of different types of humanitarian emergencies, and it also might help you think about the context of preparedness and planning as well. Even in India, the National Disaster Management Authority has lots of policy and information on preparedness and planning in the context of local and regional issues. So I encourage you to think about that as a resource as well. In India, some of the other nodal agencies and organizations that deal in preparedness relate from everything from flooding to cyclones to avian flu and H1N1 swine flu, but even chemical releases and industrial releases, rail accidents, nuclear incidents. So again, as you assign these scenarios, understand and try to think about it in the context of how one would actually have to mobilize to address the situation locally, because that information exists. More than just calculating and modeling, then think about, well, what are the real implications of this? How might we use this information and make a policy recommendation? In India, we know there are lots of vulnerabilities related to this. One is earthquakes. Lots of earthquakes in India. Also drought, flooding, and cyclones are also significant. Some cities are vulnerable to chemical releases and industrial disasters simply because of land use and the siting of facilities. And we know there are also the potential of man-made disasters. And so just as in my country, we have a very similar situation where industry could be clustered in various places, which increases the potential of this type of thing. It's also very significant in India. Other areas of concern that you might consider are the fact that there needs to be improvement in early warning detection systems. Again, in the US and in other countries around the globe, we are all struggling with this. What are the efficient mechanisms for integrating this scientific knowledge? Right? So again, you're locked in a room for a week working on this. And if you come up with a finding that really could help improve policy, how is that communicated to administrative agencies? What is that feedback process? And since it's multi-sectorial, what are the challenges and barriers to that? Communication and the collapse of communication during an event, a release, or a disaster. Again, this is a worldwide problem. There needs to be more attention to that, considering the fact that oftentimes these systems fail. And the vulnerability of not just infrastructure, but even subpopulations, special populations that may in fact have more impacts or disproportionate impacts. And I'll talk a lot about that later this afternoon. Some of the future directions according to the NDMA here in India include mobilizing more stakeholder participation. So acknowledging that there are vulnerable groups, including women's groups, youth groups, how to sort of have a community-based approach. Also anticipatory governance, understanding that, again, since it's multi-sectorial, how can you incorporate this across sectors and have drills and scenario analyses that would really then address the implications in those various sectors. Some of the indigenous knowledge systems and coping practices, some of the social cultural implications of that. I mentioned community-based disaster management and inclusiveness, which again is more of an approach being adopted around the world. Again, in my country, we have had several situations, including Hurricane Katrina, where we noticed, what a failure we had in our preparedness system and how we had to be very sensitive to some social, cultural, and social economic factors that were under the radar screen prior to that time, even as basic as how do you move populations, large groups of people who are underserved in that type of scenario, and how do you track them? And so, we probably have a good example to point to as to sort of how not to do it and what we learned from that. Technology-driven, but people-owned approaches. So I mentioned how sort of portable and mobile technology is being used increasingly, particularly in rural areas and community-based initiatives, and documenting and disseminating good practices and lessons learned. That's key because we can only really advance from understanding what we did wrong and what we did right in previous situations. Finally, there's some accountability involved in having public-private partnerships. So understanding that private entities must play a role in this as well, can not only be a public mandate. So I want to skip ahead here. You have all these notes, but I'm standing between you and lunch. So some of the things I want you to think about as you're preparing your cases include, one, the risk identification process and the ability to think about it from a vulnerability assessment perspective. So the populations and assets to be exposed in that given scenario. And the probability of not just loss of life, but what are the other implications? Because in fact, when we're looking at these, and we know even the cost-benefit analysis of it really is based on everything and not just sort of what we can measure, but what's actual feasible in terms of how we manage the risk once it's identified. Measures to address the vulnerabilities through early warning and sort of how one might implement actions such as new standards, environmental protection measures, management practices to reduce future vulnerability. So think about that as you're doing your work. And how to really take a preparedness approach. So once you calculate everything and realize how depressing the scenario is, how can you use this information to improve policy, to improve the perspective? So some key lessons are, they're bound to yield more effective returns if we can incorporate this data and information in preparedness and mitigation rather than waiting to after the release or after the event and distributing relief and disaster aid. Also, creating a culture of prevention and preparedness. So understanding that we don't want to wait until after the situation has happened, but we want to be positioned to be able to address it. So the types of work you're going to be doing this week is that type of concept that we're modeling this stuff and we know the potential. So how can we really then begin to inform and appreciate the creation of policy and plans? And developing a code of conduct for all stakeholders because, in fact, you're not working in a silo. We have to work across sectorial lines and across different stakeholder groups. Investing in preparedness and prevention, understanding that that's going to yield more sustainable results than spending money after the disaster, and using the information to predict, to understand that certain areas of the country, certain community groups, certain populations are going to be more vulnerable. So if we know that in advance, being able to plan and involving the community. Finally, I want to point you to the fact that because of the lessons learned, for example, in my country, as a result of some natural disasters. There has been a real upswing in infrastructure and capacity building in preparedness and public health. One of the things that evolved was sort of competencies and training at the master's level, specifically in public health, in relation to preparedness and response. So there are defined competencies that span everything from roles and relationships. So how do you work together? You know, who's the key speaker and stakeholder in terms of communication and information management and applying new strategies and sharing information across sectors, planning and improvement and identifying those key components for operation plans, and assessment, assessing the needs of the community, the population health threats, assessing the capabilities of the system. Finally, incident management and addressing the needs of specific populations, ensuring that there's cultural and competent care and actions taken in relation to public health, but also applying it in the context of worker safety and health, which again, we've had some scenarios where we failed miserably at this as well. So in closing, for those of you who have an interest beyond sort of just doing this week and in the context of your own training and profession, you might want to take a look at some of the master's level competencies that every public health practitioner should really be able to embrace. Thank you, and I'll entertain any questions.